I didn't come here at 16. I went to a college, a 2-year college we had back home. I was studying business administration because, what else was I going to do at the time? Because the nursing program back home was not, it wasn't the best, to put it that way. And I was still too young at the time. So I moved to the US when I was just about to turn 19. So I'm thinking, I was like, I raised myself. I tell my friend, I raised myself from 19 to now because I moved away fairly young. It is still young, but so I went to that program straight away, and I've ever since been trying to, settle down, put it that way.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 54. Everyone, Omari Richards here. Thank you all so much for joining me today. Be sure to subscribe, to leave a like. If you're on YouTube, it helps the algorithm. Share this with a friend. I definitely appreciate you all. If you want to support, you can go to buymeacoffee.com/the PH Millennial, and you can support the show and the platform there. I'm really glad to have this person on the podcast today. She definitely drops a lot more insights than I knew she had in her journey. I just thought her journey was a lot more straightforward, but it was not. And I'm glad that she was able to share all of the knowledge and the wealth of insight that she's gotten from all the rejections and how she's persevered and gotten to where she is right now. You all probably do know her if you're connected on Instagram with me, but it's a great story and I look forward to telling it with you all, so enjoy. Today we have a compassionate and dedicated public health professional and another fellow podcaster. She's also a birth and postpartum doula and the founder and CEO of Scrublife Cares. She got her Associate of Arts in Liberal Arts and Sciences at the Borough of Manhattan Community College. She completed a Bachelors of Science in Public Health at Georgia State University. You may know her on Instagram as Tea With Tanya K. Along with being the founder and CEO of Scrublife Cares, she works as a birth and postpartum doula and placenta encapsulation specialist, as well as works as a housing processor at the Georgia Department of Community Affairs. Lastly, her podcast is Tea With Tanya, where you can find her on all platforms and on Instagram at Tea With Tanya Podcast. We have Tanya Ambrose, BSPH. Welcome to the show.
Hey, Mari, thanks for having me. It is an honor to be here. I'm a fan, number one fan from day one. So to be on here, it's truly an amazing feeling. So thanks for having me.
Yeah, truly is my pleasure. I know you have been supporting me as I have been supporting you since I've gotten onto Instagram as a public health person. So it is really nice to connect and just be able to tell your story. So how have you been doing?
I've been doing well. I'll say that. In the beginning, life didn't necessarily stop for me because the work that I was doing, I wasn't the one working from home like everybody else. I was still having to go out, put my life at risk. But, I usually travel back home at least once or twice a year, and I haven't been able to do that since the pandemic. So that's been a bit frustrating or sad in a sense, but, thankful to have life and just trying to push through and do my best to practice social distancing and, the little requirements that I have to do. But it is getting better. So hopefully it stays that way.
Okay, that is good. Where is back home, just so people could know some context?
Yes. Whenever I say back home is Antigua. I tell people I was born in England, but I grew up on the beautiful Caribbean island of Antigua. So whenever I refer to home, I'm always talking about Antigua, not where I'm living here in Georgia, but Antigua is home. Beautiful Caribbean island that I miss so dearly. So yes, that is home, people, Antigua.
Okay, well, and I hope that you are able to go back home sometime soon. I know we were talking before, and you said hopefully around Christmas time, winter time. So I hope that for you, and I hope to get back to Trinidad at some point in time, maybe around that same point in time.
Well, we hope, because in Trinidad, it's you guys are on a strict lockdown since last year. I have a friend, she's complaining, I want to go home. I said, well, I don't know what's going on in Trinidad, but hopefully it opens up. So
Yeah, it's just crazy that they're like one of the only countries in the world that
yeah.
close their borders down to their citizens coming home. So
Mm-hmm.
yeah, it is very fascinating.
The
But
times we are in.
yeah, but thankfully they've been getting like a lot of vaccines lately, and they
Yeah.
thought there was a lot of vaccine hesitancy, but it seems like there's a lot less now that there are vaccines there, so people are getting it, which is good. So we'll see how
Yes.
everything
And
goes.
it's the same thing back in Antigua as well. So, we are grateful for that.
Yeah, awesome. So tell us, how do you identify, and then tell us a little bit about your personal background.
Right, so my name is Tanya, identifies, she, her. My personal background, like I mentioned earlier, I was born in England. I like to put that fun fact in because it's part of who I am. Grew up in Antigua. Then I migrated to the United States a little over a decade ago. Now I'm thinking this July actually would make 12 years. Wow, that's a long time to be away from home. But I migrated here to finish my tertiary education, and I'm still here. Still here trying to get an education, still just living here. It was always my goal to move here, get the education, and go back to Antigua. But things happen, life happen, and I can still make an impact back home. So that's what I do. As Omari said, I'm the CEO and founder of a nonprofit organization called Scrublife Cares. And I currently work at the Georgia Department of Community Affairs. Got that job through a teacher or professor. We'll talk about that, I'm sure, later in this episode. But, I am just here trying to do some good in today's society, even if it's just a small impact. One thing or helping one person truly does bring me joy. And I think we make an impact or, on someone else's life. If I can do, I like to say I'm privileged enough to be in a position where I can help. So I want to use my privilege for good and not for, something negative.
Yeah, absolutely. That is awesome. And yeah, I definitely look up to you in the fact that you have opened up this nonprofit that's helping underprivileged communities back home in Antigua. And I just feel like a lot of us go away and we don't give back, and
Yes.
that's definitely aspirational and inspirational. So thank you for doing that. And we're definitely going to dig into that a little more. But tell me, what was, you said you came to the US from Antigua to complete your tertiary education. Tell me a little bit more about that process.
It was stressful. I'll say that because back in the Caribbean, essentially at 16, you're getting ready to graduate high school or secondary school, as we call it. So what are you going to do at 16? So of course, thankfully, my family and I, well, my parents and myself, we got our green cards right in time when I was about to finish high school. So it was like, do I go to England to finish my education, since we in the Caribbean follow the British way of learning, or do I come to the US? But most of my family lived in the United States, so it only made sense to me to come here. So the application process and the different things we had to do was just so stressful. I had no idea what I was doing, where I was applying to. Thankfully, I applied to the CUNY school system, to the City University of New York system, to more than one school. I said, okay, I was studying business in Antigua. Do I want to do that? And I'm like, no, nursing was always my thing. I remember growing up playing doctor or nursing with my cousins or my siblings. So that was always one of my goals. But anyway, got into the school, to the community college here, and went, and I was telling them, I want to be a nurse. They told me, okay, the best thing for you to do was to do the liberal arts route. That way it's like a generalized program. You can do sciences, maths, whatever you wanted to do. But I had to get all A's in 4 classes in order to get into the nursing program. And when you come from the Caribbean, you study hard. You're here for one thing, you got to focus on, which I did. And when I tell the story, I often get upset. I grew up in the Caribbean, so our way of spelling certain words is totally different than what it is here in the US. By a letter or two. And I remember when I was taking that English class, she gave me a C+. She's like, oh, ma'am, you're spelling the words wrong. And I'm trying to tell her, it's not really I'm spelling the word wrong. I'm coming from the Caribbean. Just tell me, adapt to the US way. So anyway, long story short, I didn't get into the nursing program at that point in time because of that one class. I just completed my liberal arts degree and decided that I was going to, be on that quest to still get into a nursing program, but it just wasn't going to be at that school at the time. So I have never in my life used my liberal arts degree, if I can, besides just to get into another school,
Okay. And yeah, that is quite fascinating. Like as you were saying that the teacher, like, because I definitely resonate with that. I definitely spell like even with when you have your label with Tanya, I would spell Labour.
Right, but you're trying to adapt to the US way. So I'm like, okay, what? Let me just conform to that, because again, sometimes it's still hard, even after a decade. It's still hard for me to still not spell it the way I do back home. So that's still a challenge to this day, which is so crazy.
Yeah, I definitely agree with that. And like it depends like who I'm talking to, like how I would spell it. And I remember like in high school when I went from Trinidad to the Middle East to the
Right.
American National School, the teacher was like, because she knows I'm from like a British system, so I spelled
Mm.
with the U and like
You.
yeah,
Yeah.
that's usually the biggest thing. And she was like, some professors in our college wouldn't like it, some would be okay with it, so it really
Yeah.
depends. But just know that there is another way. But it's just fascinating that the teacher would give you a C for something like that.
Yeah, that broke my heart. I was like, wow, it's like I didn't know what I was doing. It was just who I was. I just moved here. So it took me a while to adapt to that. And, here I am. Still, as they say, depending on who I'm talking to, I'm going to spell because I don't want to lose who I am too. I feel like, me doing that is losing my Antiguan, but,
Yeah,
we got to do what we got to do.
yeah, neither here nor there. So
Yeah.
when you came here at 16, you went straight into that program?
Well, no, I telling back, I didn't come here at 16. I went to a college, a 2-year college we had back home. I was studying business administration because, what else was I going to do at the time? Because the nursing program back home was not, it wasn't the best, to put it that way. And I was still too young at the time. So I moved to the US when I was just about to turn 19. So I'm thinking, I was like, I raised myself. I tell my friend, I raised myself from 19 to now because I moved away fairly young. It is still young, but yeah, so I went to that program straight away, and I ever since been trying to, settle down, put it that way.
Okay, definitely fascinating. Okay, before we get anywhere, what does public health mean to you?
Funny story, I had no idea what public health was at all. I remember when I was still trying to get into this nursing program in that particular school at BMCC, my aunt kept telling me, oh, you should do public health, because she was getting her degree in public health. I said, what is that? She said, it's such a broad field. You can do this, you can do that. And I'm like, okay, I'm still not sure. But now that I'm in it, for me, it is like to be of service. That's what it means to be of service to others, especially those in different communities. So that's essentially when I think of what public health means to me, is to be of service to others and to educate and to empower, which is kind of like my tagline. Because when I learned that the roads that we drive on, the stoplights, all these different things are from public health, I was like, wow, you think, okay, it's this government sector, but it really is public health. Having access to healthcare here, which is what I had to deal with coming up to this country, is public health, which is why I'm trying to be an advocate or fight so hard for us to be educated. Because I'm telling you, the healthcare system here, I had to learn the hard way. So public health really is just to be of service to others and to educate and empower.
Yeah, I like that a lot. And yeah, there are lots of challenges coming to the US with the healthcare system. It's really poor to be in such a wealthy nation and you have one of the worst health systems out there.
That was shocking to me. I was like, wow, from a small Caribbean island, you think, oh, let's go to the US to get, better health, which, come from a Caribbean island, it might be an upgrade, but when you actually live here and you see just the standard of something, it's like, wow, we gotta really educate ourselves.
Yeah, for the common person, it's not as the system isn't as accessible to as the common person in like Trinidad or Antigua. You can get a lot more access for common things a lot easier.
Yeah.
So going back to your associate's program and with your liberal arts degree, what did you learn from that per se? You said you didn't really gain anything. You didn't use it for anything besides getting to your doula program. So what did you learn?
It's more, I did a lot of science classes because again, I was based on trying to get into a clinical setting. So I did a lot of science classes, history, because that was just a requirement. But I did, what I'll say, I'll learn, I guess, how to network. That was my first foot in the door of how to network with people, because I still have friends from that program that still help me to this day, or we help each other, just to communicate or I guess boost each other in today's society. I just recently reconnected with one person just yesterday. She started talking, I'm so proud of what you're doing, XYZ. But I did a lot of science-based classes. So all of my science knowledge from that particular program has helped me to this day to where I am now. So it was heavily science-based, but as far as networking, it started there. And that's all I can say about that program. Everything else, no.
Okay, that's fair enough. And networking and getting into that networking and being able to build those relationships, especially coming over from a different place with a different culture, I think that's a crucial thing that you could learn there at that point in time.
Yes, the good thing about that program, it was a very diverse school. They had people from Trinidad, Jamaica. It was like the most diverse school I've ever been to, of different races and cultures. So that was a good thing too.
Yeah, that is awesome. And then after this role, you became a library assistant at the Roanoke County Public Library and also patient observation assistant
Yes,
at
let me
Carleton,
tell
right?
you how I got there. Yes, so after I graduated from BMCC, again, I was still determined to become a nurse. And I'll just, if you don't mind, I can say why I wanted to become a nurse. As I have an older sister, she's older than like 5 years, but she had my niece. She was pregnant. She lives in Canada. Came to visit me, and one day she's like, "Oh, I didn't feel the baby kick." And me not knowing anything about pregnancy at the time, I'm like, baby, she's just probably tired because we were walking around all day. And she called her mom. She's like, that's kind of weird. It's strange. You should go to the doctor, which we did. Long story short, she had to have an emergency C-section at 20 weeks. And in that short space of the decision making, the doctors were like, it's a 50-50 chance. You should just terminate the pregnancy. I was younger then, but hearing a doctor at the time, which is why sometimes I still side-eye doctor, sorry guys, because it was just a sad time at the moment. Oh, you should probably terminate the pregnancy. So I'm like, if we have a 50-50 chance, the other 50% means that she's a chance of survival. Why should we want to just terminate a pregnancy when there's another 50% chance? Anyway, long story short, my sister ended up giving birth to my niece. She's still here, just turned 11 2 weeks ago. And she stayed like a year and a half in the NICU. And let me tell you, Omari, the nurses, which is why I often say nurses are the backbone of this healthcare system, because they took such great care of my niece. That was my first, I guess, direct impact of seeing nurses in action. And they took care of my niece, me, my sister, everything. And to this day, we still talk to them, sending them pictures just so that they can see the impact that they made on my sister. So that's when I decided I want to become a nurse. So fast forward to me moving to Roanoke, Virginia. Found a school that didn't have any, entrance exam, everything, and I got in. And well, here I am, leaving Antigua, coming to New Jersey, and then leaving from New Jersey back to Virginia. But, I wanted to become a nurse because I wanted to be an advocate after seeing what my sister went through. Got into the program and essentially failed out a year and a half later by 0.5 point. And that's an essential part of my story. Every time I tell this story, it makes me sad a little bit years later, but I have to put in that 0.5 point because it was like, I was so close and you guys are going to dismiss me from a program for 2 years, So then that's when I became the library assistant. It was part of the work study at that nursing program. And that essentially, when I think back, was my first foot in the door as far as public health, but I didn't know at the time. Because even though I was a library assistant, I was working with the director, working closely with the director of the library and the other librarians to help to build certain programs for children and for the homeless people, because at that time, the homeless population there was very, very high in that small city. So, I was in the weekdays, I would do like office admin work, but on the weekends, I was helping to, read to children or create this particular program to help them with artwork and find jobs for the homeless people. We use the computers, teaching them how to, use Google. So that was my first step in public health without even realizing. So that's what I did at the library. Even though I was a library assistant, I was helping those who come from different backgrounds to find jobs or how to read, write, these different things.
Yeah.
It was through that nursing program technically why I got that job. But yeah, it's still one of my favorite jobs, even though I've moved past it now. I'm still in connection with some of these people because of that job.
Yeah, and that's awesome that you were able to get some public health experience helping underserved populations, homeless populations. A lot of people have never worked with homeless populations, haven't spoken to homeless people, understand the type of struggles that they have. So that is a huge amount of learning in itself right there.
Yeah.
And I'm sorry that you had to feel out of that program by 0.5 points.
0.5, but it had to happen. That's what I tell myself now. It had to.
Yeah, and it's also like you took a big move to move from New York to Virginia to this. It seemed like a small town.
Yes, I didn't know anyone there at all. So that was a culture shock too, because it was predominantly white. And I'm like, okay, I'm new here, but again, some of my friendships that I have now came from that same nursing program too.
Okay, awesome. And you were also a patient observation assistant?
Yeah, so because as a nursing student, you have to have clinical experience. So that was my first ever anything as far as with direct patient care. And I did that. It was like, sitting, observing like a one-to-one, like those on the psych ward that would need, evaluation or observation. I did that. I would like take vital signs. And luckily that hospital was a teaching hospital. It's where we did our clinicals as well. So even though I wasn't like directly doing anything besides observation, me taking my notes, I had the chance to do something with some of the nurses and the doctors there. Because again, they knew I was a nursing student and ask us anything and we'll teach you. So through them, I was able to gain skills in that department, which the skills that I have now, I will continue to have, came from that position, being a patient observation, changing patients, taking vitals, charting, which is something that I still cherish, and it's still on my resume because of that same job. I'm able to have that training, and I'm able to build and enhance my skills in that department.
Yeah, okay. And it's good. It's good that you're highlighting like the failure of nursing school also brought with it these experiences and skills that you've learned that you can still speak about today, and have helped you throughout your journey. So I'm sad that the nursing experience at 0.5 points. That's crazy.
It is. I'm telling you, that will crush anybody. I don't care how strong you think you are. At 0.5, it still makes me sad, but I've moved on.
Yeah. I'm moving on. So after you got a certification in phlebotomy, phlebotomy technician or phlebotomy.
Yeah,
I don't know how to say it. I was supposed to look it up before the
phlebotomy, yeah.
Okay, thank you. At Health Tech of Georgia. So why did you want this, and then what did you learn from it?
Okay, so another story. I have stories, guys. I can write a book with just my educational journey. But after I fill out of the program, after I fill out of the program, I'm not going to wait 2 years to start another another nursing program. So I started doing my research and deciding where can I go. And being that you failed, and I'm sure those of you listening, if you are in that field or if I ever fill out any program, you can think of where do you do next? Where do you go next? What do you do next? And I did my research. There was nothing to do online. Like, what do you do after you fail a program? I didn't see anything. So I'm like, let me just try another school. I didn't want to stay in Virginia anymore because I was just really that crushed from feeling out of that program. So I did my research and found some schools here in Georgia. I'm like, okay, it's a 7-hour drive in my car. I can make that trip, with a U-Haul or whatever. And every time I would apply, guys, I made sure I told them that, I was in this nursing program. I failed out because different schools have different requirements. If you fail out of a program, that's it. You can't even apply to that program. So I was explaining this to these schools, and they're like, no, that's fine, X, Y, Z. So I'm like, okay, applying, spending money, because I'm making sure I'm calling before, because we all know application fees are not cheap, right? And I ended up getting into a program, thankfully, moved from Virginia all the way to Georgia, guys. Got into the program, and even before we started the program, I was at the orientation. I said, you know what? I feel out of a nursing program about a few months ago. Are you guys still sure? Even though I had the acceptance letter and everything. Because, again, knowing how it is in this field, I wanted to make sure everything was aligned. And they're like, yeah, everything is fine. School started in August, guys. And the end of September, I'm getting a call from the dean of admissions of the nursing program. Come and see me. Something, okay, I'm a law-abiding citizen. So, it could just be a check-in. So I went. And they're telling me, oh, we did an audit on your transcript, and we just realized that you failed from a nursing program. And our philosophy here is if you fail at one program, we don't think you can thrive here. And I'm looking, because, again, I'm from the Caribbean, we work hard. Like I said, at 0.5, there were other outside factors that I guess for me, I didn't put my best foot forward. I'll put it that way. Because I was so busy helping other people. Because again, that's just my nature. I'm not going to blame somebody because I should have had that discipline for myself. But still, you're telling me, I've called you guys day in, day. I know you're telling me a month and a half into the program, oh, we did an audit and we don't think you can continue the program. So I had to pivot or change and stop taking the nursing classes to go and take like some other random classes just to make up, because I already financially was already, involved in these different things. Another blow to my heart, guys. It's like, wow, okay. What do I do next? So I just decided, okay, let me go do respiratory therapy, which that wasn't even something on my mind. Because again, my aunt, that same aunt, I can give her a shout out, Auntie Teen. She kept saying, Tanya, you should go and do public health. I'm telling you, you'll make a difference there. I said, okay, yeah, I still don't know what public health is. Not really that it was my calling later on. But anyway, applied to the respiratory therapy program, got in, but it just wasn't what I wanted. I was just doing something for the sake of wanting to be in school or be in a clinical setting, So I just, what, it's not for me. Let me not even go ahead with it. I applied to another nursing program here, got in, did the entrance exam, passed really high, and they told me the same thing after they accepted me. Oh, we can't accept you. Like I've heard so many no's, guys, that I don't even know how I'm still here standing. But you know what? That's another testament to who I am. So I decided to take a year off and go do my phlebotomy certification, because again, I wanted something in a clinical setting, or to have that experience, so that when I do become a nurse, I'll be a pro and I wouldn't be as new as they call these nurses. So, it was like a 6-month program, I think it was. did it, learned a lot, of course, about blood, which I've learned already in the nursing program, but actually learned about the veins and arteries and these different things, where you should stick a person, how the different, and that's why I decided to do that. So I got that certification, and here I am, just building certification upon certification, trying to, enhance my resume and just to have these different skills to make me a better healthcare provider. That was my initial plan when I did that. So that's how I ended up in Georgia, guys, and also becoming a phlebotomy technician.
That is quite crazy. I didn't know any of this before. So
Yeah.
I'm glad that we're getting to hear the story, because this is some good stuff right here. During this other, like, you moved once again to a
Yes.
completely new place. So after questioning them, and then they still came back to you after, which is crazy. Did you have like any thoughts in your mind about going back to Antigua or anything like this during this process, or were you just stuck on like, I need to like finish something here?
Yeah, I did. And it's funny, you're like the first person that ever asked that question. That's so crazy. But I did. I'm like, you know what? We have a nursing program in Antigua. Let me just go back home with that nursing program and just work at the hospital back home. Because at this point, all these no's is just, it's just really heartbreaking, especially when you want something. It's not like you're that kind of student, you're just here going through the motions. Because I've heard people say, oh, I'm just here because I'm getting paid to go to school. I said, well, how do you get paid to go to school? But they were talking about, like, the, what is it, reimbursement from financial aid after that refund check. I said, oh, but when you're here really wanting to do something. So I did think of it, but I'm like, you know what? No, I'm not going to give up. If after I try 2 or 3 more times and it doesn't work out, then I'll probably just find some other option. But going home, in a sense, wasn't an option, even though I had that thought, because when I moved here, I said I wanted to open a state-of-the-art nursing program back in Antigua. I don't know where that mind or that thought came from, but the minute I came on that plane, American Airlines heading to New Jersey, I said, I want to open a state-of-the-art nursing home in Antigua. So going back home would have defeated the purpose, I think, for me. But I did think about it, but no, I said, what, let me just continue to persevere here and see what happened. And that's what I did. And here I am.
Yes, it's kind of cool to hear that the bigger vision of wanting to go back home and do something in Antigua with the nursing home kind of kept you going and kept you here. That's awesome. And I'm glad that Auntie T was in your ear about public health.
Let me tell you, today, I said, when I got it, I said, I thank you, because if it wasn't for you, I wouldn't have done it, because she kept from day one. She said, yeah, you're such a big field, you can do X, Y, Z. And I'm like, okay. And when I told her, after I took that year off from school and I decided to go to Georgia State, I'm like, you know what, I'm going to do public health. Did my research, and I realized that I can take an alternate route to becoming a nurse, put it that way. And I realized I'm happy that whatever happened to me back then, I wasn't happy. I was sad, I was upset. But when you think about it now, it had to happen to me for me to realize that I can make an impact, as far as public health goes, I guess. I said, you know what, I want to do something in maternal and child health. Is that even a thing? Didn't even know, because again, my sister and her experience, that made me want to become an advocate. And I applied. When I got in, I told her, and she was just screaming, like she was just excited. And I got into that because I took a year off from anything school related, because I call myself a professional student. I'm going to always be in school. I can't help it. I'll complain about, oh, this is so hard, but learning is just something that I like to do, And yeah, I got into Georgia State and did public health and finished with honors, but I learned a lot. And I'm happy that I have that, because now I'm able to tell people about public health, and I can, merge it with other things that I'm doing, because it's still, at the end, the forefront is public health, what I'm doing right now.
Yeah, and definitely everything that you've done and learned has definitely added to your entire culmination of public health experience.
Yes.
So before we get to Georgia State University, you were a resident assistant at John Wesley Villas Incorporated. So
yes.
How do you get this, and what are you doing it?
Well, that was my first job when I moved to Georgia. So I'm like, okay, I'm here, I gotta find work. I need some sort of clinical experience, because I was leaving the hospital in Roanoke, Virginia, as a patient observation. So I'm like, okay, I need a job, and I found it Indeed, and they told me, you're gonna help with like medication with the different rates, because it's like a nursing facility / retirement facility at the same time. So some areas of the complex is a nursing home, some is a retirement facility. So that's working in both. So like, helping those who can feed themselves, basic stuff that people sometimes think that our elderly people don't need, teaching them how to feed themselves, reminding them of medication. So that's what I did there. And I think I learned most of my people person skills at that job, because I try to take something from every job, going forward. So I learned my people person. I learned how to be patient, because I'm not the most patient person and that you may come across. Like, I'm just always in a rush, no matter what it is. It could be schoolwork. So, I learned patience and I learned sympathy or empathy in this job. And I was there for a while. I just recently left. I left and went back, because, again, I like helping people or to be of service. And when I know that I'm making an impact, even though I didn't know I wasn't at the time when they told me, because they called me back, oh, you should come back, we miss you. And, you know, I stayed there for longer than I actually should, if I can be honest. But, you know, I did learn how to work with different types of people in that job. And it set me up for other jobs that I had or have even now.
Okay. Why do you say you stayed there longer than you should have?
Because there really wasn't any room for growth, if that makes sense. You know, what at the time as a college student, I needed a job. It was paying fairly well. It was paying the bills, and I was trying to be independent outside of my parents helping me, you know, and I was just meeting different people, even workers who were kind of on the similar path as me that I still remain friends with. So as far as, you know, there was just no room for growth. And of course, we want to be stagnant, especially when you're trying to get somewhere in life.
Yeah,
So that's what it was. Yeah.
Yeah, fair enough. And then you were also home health aide for home instead senior care.
Yes, you know, when you go to people's houses and again, medication, reminders, helping them to change, you know, whatever it is that I had to do there, light housekeeping. Sometimes before I would be ashamed to say that. I'm like, no, no, it molded me into who I am when I think about it. And I remember I was working with this one client and I had her for a year. I had no other clients but her. She was a professor at the Mercer University here in Georgia as well. You know, very prominent lady in the community here. I didn't even know that when I first went, and you know, sadly she did pass. And I still to this day I think about her because I was able to build a relationship with her and her family, and her daughter, you know, her son. They were the one that wrote my recommendation for grad school. You know, they did so many different things, and we're still in contact to this day. So that job, even though, again, there wasn't necessarily much room for growth in a sense, besides getting that skill for me to become a nurse or being in public health, because I think that is still a public health job, you know, taking care of our elderly population and those who need help. But that one job every day, because my grandmother passed a year before I got that job. And then so she became like my second grandmother, you know, in that sense. And to this day, like her death still bothers me. I'm like, wow, you know, I miss Dr. Ann, if I can call her name, sorry. But, you know, she made an impact, and that was one of my most honestly fulfilling jobs. And to see that I'm still close to her family. Anything I need, recommend, whatever it is, they give it to me. And I didn't even ask. They told me, Tanya, whenever you need anything, just let us know, even for a job. And I held them to that, and they always come through as far as that goes. So again, as I'm going in these jobs, the networking that I didn't realize that I was doing, you know, has still impacted me today.
Yeah, and I think it's important you say that, because you just saw it as like relationship building and just helping others. And I think when you do give value and you help others and you just build those relationships and be genuine, and they learn about you and you learn about them, they want to reciprocate and give you back that value. So that's dope. And I'm glad that they were able to support you and write those letters to get you.
Yes. Anytime. They said, no problem, let us know. And they were quick to us. I like that, because sometimes you ask people and they take forever, but still have that relationship.
That's awesome. So then you went on to get your Bachelors of Science in Public Health at Georgia State University. So you listened to Auntie T and you decided to fulfill the public health background. So tell me what the process of thinking about going into to get your public health degree.
Yeah, so I was doing some research. I'm like, okay, what can I do? What jobs? Because at the end of the day, when you're graduating college, you want to make sure you can have a job, obviously, to support your lifestyle and to pay your bills. I'm like, okay, what job can I get? And you can work in the hospital setting still. You can do so many different things. But at the time when I did my research, there was always a lot of HIV or cancer research study that kept coming up as far as public health. I said, okay, I do want to do something maternal health-wise, but I didn't know at the time it was a concentration or it was something that was part of public health. Again, guys, research is important. But, I did the application in the name of Antigua because I'm like, let me go. What is going to happen? Obviously, I'm trying to get into these other programs and it's not working out. Let me try that. And I got in, and my first class, I remember, the process, to be honest, it was pretty easy, straightforward. Did the application, waited a few weeks, got in, and I was screaming at the top of my lungs. I was like, wow, I finally got in. I know that it's not going to be any no's here. I'm going to learn so much, but I still didn't know what to expect. And one of my first classes was social determinants of health. And let me tell you that every time I think about whatever I'm doing, I go back to that class because I think that laid the foundation for the program. And again, the background or basis of what public health is. When I learned about health inequity and these different, I'm like, wow, I'm living in this country, you come from a small island thinking, wow, America is the great, how should I put it? Everything. There's so many opportunities, yes, but when you're learning about the different things that we are going through, especially as African Americans or whatever race you are. I was like, wow, I'm really happy that I took that class as I kept going on. It was just the best. If I could do it over, I would, but obviously I'll do it in my MPH. But if I could, continue, I will, because that class set the foundation for what public health is to me and what it is really and truly. That social determinants of health class was, it was a good ride. I'll say that. I made sure that I showed up every day, and I'm happy I did, because it trained me or gave me the skills to do what I want to do, even with my nonprofit and just as a person, And so hopefully I'll be able to do a concentration in maternal and child health, because I can't think of anything else. Women's health, there's other stuff too, but that's just really where my focus is. I can't think, let me do epidural. No, that's not for me. Oh, you should do but no, that's not for me either. Let me do the maternal and child health, because when you read the stats as well, when it comes to the mortality rates with African American, it's just not adding up to me. So I'm trying, even if my one little voice can make an impact somewhere, that's my goal.
Yeah, absolutely. And I think going back to like your sister's pregnancy and how they're saying like it's 50% and that she should terminate it.
Yeah.
And like that in itself is part of the problem. Not having providers that are able to culturally walk you through or just help you, or maybe not believing, or whatever the case might be.
Right.
And you're probably able to speak more to this than I am, but I just think that there's so much that needs to be changed and improved around maternal and child, especially for Black mothers. So thank you for wanting to work on that.
Yes, definitely.
Yeah. So you're also a clinical clinician technician at Navicent Health. So how do you come across this one?
Well, I was, because I'll give you the story why it's in the past now. But how did I get that? Obviously I did apply, because when I was at John Weston, I told him I wanted to move because there was no room for. But I'm like, you know what? I again wanting to be in the clinical setting for some reason. I don't know, guys. I'm just think I'm meant to be there, but we'll see when that time actually happens if I want to. But so I decided to apply. They were a position at the pediatric intensive care unit, the PICU. I applied there, and I think I applied under Heart Tower for some reason, and the NICU. And I did the interviews, and then I told them my story, because I feel like, before I used to be ashamed of telling my story of failing from nursing school, but no, it's empowering to me because it can help somebody else, and it's just who I am, And anyway, I got the job, got hired in the PICU, and I've seen some things that I don't know. It's just heartbreaking to see that the things that children go through. Of course, some may be born with certain diseases, but I've seen the abuse. And, sorry guys, it might be TMI, but I've seen abuse from parents to their children, like, cracking skulls and hips and bones. And it's just the things that I've dealt with as a clinical technician working along with these nurses, these amazing nurses, I'll say that, is the strength. Empathy again, but just to see that, wow, our children growing up will hear, you guys are the future of today's generation or whatever, but we never knew the impact we can have. So working with children so closely and seeing that the abuse that they endure, it made me want to work with kids even more. Because going back to that library assistant job, that was my first foot in the door in working with children at the time. I didn't know it was going to prepare me for working in the PICU, seeing these situations or these illnesses or, children dying and these different things. So that's how I got the job. I worked there for 1.5 years, I think it was. But guys, it was the best job I've ever had. But I got fired. And I can be transparent here. Let me tell you why. I didn't get fired because I couldn't do my job. Back in 2019, I did a study abroad in Uganda. It was a 4-week, like a 1-month program in Uganda. And I told my job before, I said, I'm going to this study abroad. Most jobs, you can only get 2 weeks off from work. We know how that is when you're working. You can only get 2 weeks. And I'm like, this is an opportunity. 1, I've never been to any parts of Africa. 2, we were learning about alcohol and teen pregnancy, HIV, all these different things. Again, as a public health student, that was an opportunity of a lifetime. Told my bosses, I have to go XYZ. Can you just give me the extra week, whatnot? They were giving me a hard time. But I'm like, I'm not gonna pass this opportunity up to work. I mean, no, that's just no. And I went, and because I told them, can you schedule me early in the week, because I was leaving at the end of the week, and they did not. Anyway, long story short, I left from Georgia to Montreal before I went to the different stops. And while I was in Montreal, I had to call out from work because I was scheduled to work that day. And they were like, because they didn't want me, if I called out, I was going to be fired. I said, well, I'm going to make up my mind to just get fired. And so I said, I'm not going to be hungry or homeless, I'll figure it out. And yeah, so that's the story behind me getting fired from that wonderful job, because I decided to choose my education versus having to work. I sometimes I'm like, I probably should not have called up. But I'm like, then I would have missed a trip and wouldn't have had that life-changing experience that I had. So guys, but it was one of the best trips I've ever had. If I could go back, I would. I definitely would. But, I've evolved in a sense, and that time will come again. But yeah, so, I think it's okay to talk about, people think when you get fired, it's always something bad. I don't think I got fired for something bad. It was just, I had to choose between education and working, and I chose my education.
Yeah, absolutely. I think I would have done the same. I've also never been to Africa, so well, you've been now, but so I definitely would have taken that opportunity. So tell me about that experience of going to Uganda and working.
Let me tell you that when I said that trip changed my life, I don't even know how to describe or put it into words, but that's the reason why I started my nonprofit too, and we'll talk about that. But we went to Africa. It was like a 3-4 week program, and we were studying alcohol and injury in Uganda, because that is a big thing. Like alcoholism is a big thing there. In the slums, it's a way of them to make money. Then they'll make the alcohol. Then you have children partaking in that. So then, of course, that's another issue there. But then there's a lot of deaths as well in the making of these alcohol, because again, it's not sanitary. It's not as safe. So you've had like children losing parents because one may be overdosed, or they may have drowned or been burnt. So it's just like, it's like a sad thing, but at the same time, it was rewarding what we were doing and seeing that even though they don't have much. And what I learned, guys, and I'll share this, we were in one of the slums doing some survey or something we were doing, and I was just talking to somebody, one of the residents there, and something was said, and they were like, oh, we don't know that we are poor. We don't know that we don't have. And when I said that, I said, that reminded me of back home. Like, there's like a similarity in cultures as well, from being from the Caribbean as well. But it's like, we in the bigger countries or first world countries, we think, oh, Africa, they're so poor, or they don't have this, they don't have that. But in their minds, they have a lot, they're rich. So that was like one of my keys. I was like, wow, if you can get people to not look down on people in certain environments or certain socioeconomic status or background, the world can be such a better place. Because here we are thinking, oh, we're coming in to save the day. But they're so full and they're so rich of life, which from what they have. And that also just truly changed the way I think about anybody going for. I'm like, I may have some privilege in a sense, but they're probably more privileged than me because they're at peace. You know what I mean? Yeah, we have our privilege come at a price sometimes. So, that trip honestly changed my life. And I'm still in contact with some people from over there. I hope to take my number from over there one day. We'll see. But, I'm still in contact, and I still try to even send stuff to some of the children there because they are in need. And again, if I'm able to do so, why not? But that trip really made me look on life and even the world differently, especially living from in our privilege. Like, we're thinking and we're helping, but they are so rich and full of life, and they have that peace and that happiness, regardless of what their circumstances is. So that was a lesson for me as well.
Yeah, that is amazing, and I'm glad that you were able to fire your job and go on this trip.
You know what I mean?
Yeah, I think it definitely was worth it, and I'm glad that you were able to get that experience. So you're also an intern at the Georgia Department of Public Health. So talk about that experience.
I did it for a few months, and let me tell you, guys, before I even continue, networking and getting or gaining or building a relationship with your professors in school is the best thing you can ever do. And I'll say why, because me, in the beginning of my public health degree, I'm like, let me go to school, I'll go to class, take my notes, leave, do good on the exams. And I wasn't like communicating with my professors or my class. I'm like, what? I'm just trying to get home. Because again, my commute was like an hour long as well. I'm like, let me go to class and get home, and that's it. But towards the end of my program, the last year, I was able to build relationships with my professors. And even from that same trip from Uganda, I was able to go on a research team with one of my professors. And we did photo voice and all these different things. So it was the dean of the School of Public Health. I did a class with her my last semester, and she sent me the email. I think she sent a bunch of us the email as well, so I'm not going to feel like I'm so special, but she sent the email. And those of us who would have applied, she said she would do a recommendation for us. So if it wasn't for her even sending that email, I probably wouldn't have even know where to look. Because again, at the end of my public health degree, we were supposed to do a study abroad in Haiti. But then, of course, COVID happened, and that just changed the world. So I didn't have any plan, to be honest, guys, after graduation, besides going to grad school. But then everything was just so close together. I was burnt out because I've been going to school since I was 2 years old, guys. So I was just tired. And yeah, it was through her that we got the job. And then I like to say, thankfully, but still not thankfully, because of COVID, I was able to get that job because I was working at the COVID call center. We were trying to schedule people for testing, getting them situated as far as housing and these different things. So I stayed there for a few months, but it was through my professors. All the jobs that even the one that I have right now, came from my professors at Georgia State University, because again, I chose to network and show my interest and try to work with them in whatever they were doing. And that came, I think, from you, Omari. I'm trying to think back because, I think at that point in time, I would have met you on Instagram while I was doing my degree, and you would have talked about the power of networking. I remember when you had those Zoom calls and I was on there, and I remember I took a screenshot of the things you can do to network. And honestly, I always got in the back of my mind, like, okay, I'm already saying this, let me try to network and, to see what's going to happen. And so far it's been good. Even with LinkedIn, I've been utilizing that, not as much as I need to, but I'm trying. But it's because of you, because back then, LinkedIn, let's have a LinkedIn, create a LinkedIn account, then that was it. Mm-hmm. But because of you, I've been able to network and even meet people on there. But yeah, so that's how I got that job from the dean of School of Public Health for my school. She sent the email and she did the recommendation, and here we are. Well, then the other job that I got, and yeah. So it was all from my professors. So I'm grateful for that.
Yeah, that's awesome. And I'm glad that I was able to help you with that. I should definitely host some more of those Zoom calls.
Yeah, I'm telling you. You should.
Okay, so
guys, I'm telling you, he offers value. I have to just give him a little plug. He does offer a lot of value because I am in the position that I am as far as public health because of you, honestly.
Thank you. That's very flattering. That's very flat. That's gonna make the rest of my weekend. Appreciate that. But yeah, I think like professors have an incentive to help you as a student because it's gonna maybe help them. It's gonna help the school out. So yes. they're great resources, and they know so many people on what different things are going on. So definitely just connect with your professors and build those relationships. So you are the one on that email.
That's really important.
Yeah. Do you have any tips for people on how to connect with professors, or how you went about pushing more?
Well, for me, and I'll say my experience, guys, definitely, because they're here to help. I think I was in a research. I was in my research class, and I was just having a hard time finding something, and I just went one day to the office hours, and we just started talking. Because again, they're there, guys. I mean, they're there waiting for us to come to them. It's their job to come to class to teach us, but they're waiting for us to come and communicate and network. And that's how I even got the job in that research team. And to this day, even though I graduated now, I'm still on that team. We still meet every Monday, not in person anymore, obviously COVID, and I'm working, but we have different, meetings every day just to stay in touch. And I've even spoken at one of my professors in one of his classes about what I'm doing now, So it's just about a simple question. Look and see what they're working on, because these professors, they're always working on something, guys. They're always working on some sort of project, even though we think that they're not as busy, but they are. So when they stay long to reply to your email, they are working on things. So just try to do your research and see, or even just ask them, hey, what are you working on? And again, they're going to share because it's what they're passionate about. So they're going to talk your ears off, telling you what they're working on. And you can just find your way to say, can I volunteer? And I'll say this, and this may be different for some people. Don't go and say, okay, how can I get paid? It's always a volunteer. That's what I've come to. I mean, I never asked to be paid, but when you volunteer your time, they like to see that. And then that could also lead to, so like for me, I got the internship, that was a paid internship, XYZ. So it could just volunteer your time and your services to these professors. That's honestly my advice. It's a simple question or a simple, what are you working on? I'm interested in this field. Because I sat down to one of my professors, Dr. Comey, I have to give him a shout out. He's just amazing. And we did like a 5-year plan for my life. Because I'm telling you, this is where I'm coming from, what I want to do. I don't know how to get there. And he just mapped it out so clearly for me. And, I'm not really following everything, but, but most of it I am following. So I was able to have that connection with him, and he's able to guide me, to where I am now. So definitely just a simple question, guys, can go a long way. And don't be afraid. You're in that class, you're there to learn. At the end, you have your end goal, and they can help you, believe it or not.
Yeah, absolutely. So definitely tap into your professors. And I think even to the point of like just going through the process of the 5-year plan is good in itself, because it gives you that vision and gives you like the end goal. How you get there is definitely not going to be the same as the plan is. But just having the plan, I think, is a great way to start for a lot of people, because a lot of people don't have that at all.
Yes. That's definitely a thing.
So you were a COVID-19 case investigator for the community organized relief effort. How do you come across this, and then what did you do?
Again, a professor, guys. I mean, my professors are just saving my life out here after graduation. But because that is a nonprofit organization. I think it's run by Sean Penn, the actor Sean Penn, and it was mainly based in LA at first, but then they started branching out, especially because of COVID. And my professor sent me the email. Oh, you should apply to this. I'm like, okay. I said, why should I? I'm like, you know what? Let me apply, and I did. And I started out as a COVID-19. I was doing the test taking. I was the one swabbing your nose, and because I had my senior certificate and my phlebotomy. So that was like a skill that I had. Again, going back to the past, been in the present. And so I was taking the test, and then I ended up moving up to becoming a case investigator, which was a stressful, a rewarding but stressful job because it was a mixture of contact tracing as well. Then, you're having to go physically to people's homes. And guys, I mean, I've encountered some some people, they were willing to give the information. Some they were, oh, how did you get my information? They're shouting at you, and then all you, like I've even had, that was my first time, how should I put it, being, I don't want to say racially profiled, or had that racism be that prominent to me. Because, I've been here, people say, oh, I said, no, I grew up in a country where that racism wasn't a thing. So moving here, it didn't really faze me because, if you're going to come for me, I'm either going to ignore you or just educate you on what's what. So I never had that experience until I was doing that case investigating job where I was being cursed at and everything. But it was still rewarding knowing that at the height or the peak of COVID, we were still trying to get that information to do that contact tracing to make sure that everybody was, doing their part to lower the spread here in Georgia. Because at one point, I was wondering if we had COVID here because people were still living their best lives in this particular state. So that, but again, I got that job through my professor, and I was able to move up, do the work, and got that position until I moved on to something else. Again, a job for my professor. I'm just repeating the word professor because that's really hard. I've been blessed to be getting these jobs from my professors. So I worked there for almost a year, and then I just started a new job early this year. So, but it was really a reward. Again, that was like my first actual thing, I guess, public health related again. Thinking, okay, I'm making an impact. It's COVID-19, you're trying to spray, you're trying to give resources. I was doing like resource coordination as well, trying to get people supplies to clean and food or whatever, because again, some may have lost jobs or, you have to quarantine. So it was really a rewarding job, I'll say that. Another life lesson and skills to add to my resume.
Yeah, definitely being of service, as you said, like really drives you. So that definitely is something. And I'm sorry that you had to experience negative.
Look, but again, like I said, I because how did you handle that? I say, I'm from the Caribbean. We're just, and I hate having to say I'm from the Caribbean, but we're just built different. Like certain things, it doesn't freeze me. Some people, they just don't have the education or they can't help themselves. So I'm not going to be mean back to you. You can say what you want to say. Sometimes the best thing to do is to ignore, because I'll ignore like a racist person, and then they'll question their own existence. That's the level I try to go to, because it's like, you're not gonna belittle me. I'm not gonna come down to your level, And of course, that's not easy for everybody. Let me put that out there, but we all deal with things differently.
Yeah, absolutely. So was the next position that your professor got you the housing professor at Georgia Department of Community Affairs? So tell me about that.
Yes. So while I was on the job, she's like, oh, hey, I have a position for you. The pay is really good. You can be something you can, build your public health career in, because she knows I'm still in that maternal child health mindset. But so okay, I applied, did the interview. It was an intense interview, but then I got it. Again, thankfully for COVID, because I was supposed to be working with trying to find housing for the children and parents, but then it turned into, because they have this new program here in Georgia, it's a Georgia Renal Assistance Program, where those who are impacted or affected by COVID, you may be behind on your rent or even evicted, trying to find housing for them, trying to pay your past due rent and even your electric bill, whatever bills you may have, to get people back in check. Because again, many people have lost their job. It's a tough time. I know the country's opening up now, but people are still out here struggling really, really bad. It's just sad. Some days at work is rewarding because you're giving them the help, but some days like, wow, people are still out here struggling, and people are still trying to kick them while they're still down. So that's my role, trying to find housing for people, families, and just trying to do my good here. And I still, which I didn't think I'd tell you, I work as a behavioral aide. So guys, let me tell you, I just work. I'm a professional student, and I'm always working. I don't know where I find the time to even do anything in my life, but I work as a behavioral aide as well, working with foster children, trying to teach them coping skills and all these different things, because again, they've been in the system. So I also do that part-time, working with my little kids, you know, I've become so attached to. But that's I got that job again to a professor. You know what? I'm gonna stop saying that, but that's just my truth. You know, so she's like, oh, this is the part-time job for you. I've started doing it's just reward. Again, I think my life purpose is to be of service to others. So that's what I do daily.
Yeah, absolutely. And one thing that like I am writing an article right now talking about like one thing that public health jobs get that others don't, and I think is like that fulfillment, that feeling that you're doing good work. I know a lot of people don't like their job because they feel like they're just plugging away, doing nothing, not helping anyone. But that is definitely one thing that public health jobs do. They're meaningful. They're helping people, they're being impactful in people's lives. So
yeah, even if it's just one person, you still feel fulfilled at the end, and that's my motto. Even if it's just one person, it's still something, you know.
Yeah, definitely, it's beautiful. So now taking you back, you are the creator and blogger at All About the Scrublife, which then I'm thinking morphed into Scrublife Cares nonprofit. Or tell me all about that process, because I know you were like an Instagram blogger around public health and like lifestyle stuff. So tell me about this development.
Yeah, so I have a blog. It's called allaboutthescrublife.com, which that name is going to be changing soon, but you know, we'll talk about that. But yeah, I created that blog when I first failed out of the nursing program. I was looking to see, okay, where do I go after you fail? What happens next? And I just couldn't find anything. I was just like, okay, you know, let me just apply to another school, because no one tell you how you're going to feel, you know, the stress that comes after that. So that was my motivation behind creating the blog, was to show people that, you know what, you can fail out of a nursing program. You can fail, but you can still pick yourself up and just try again, as they say. So that was the motive behind the blog. It has since transitioned to a lifestyle. You know, I haven't been as consistent, I'll be honest, guys. It changes to a lifestyle, but now I'm getting ready to go back to why I started it again. I'm going to be sharing more about like maternal and child health, women's health, because again, it's who I am. And I think I was trying to conform to the social media life. And I'll be honest here, guys, because if you're listening to this, you're on social media, whatever it is that you do on social media, where you're influencer, you're trying to educate and empower, it can be so stressful. Omari, I'm sure you probably feel that way sometimes, trying to keep up or trying to, okay, this is not working, let me try to do something to, you know, and I'm like, no, this is not who I am. I'm not going to be out here trying to please somebody or something that is not true to who I am. So I'm just getting ready to go back to sharing my women's health content, my maternal health, and, you know, document my doula journey, and of course my road to grad school, because that's still a thing that I'm working on, even though I've been quiet about it on social media purposefully, because, you know, you got to be careful, and I want to make sure everything is in alignment before, but document all that journey to be a source of inspiration to others, and also provide a resource to those who are, you know, thinking of becoming a mom or just want to know more about women's health. And it still ties into my public health, because I say, no, I'm sharing public health stories. And for a while I was like, you know what, this is not really public health. I'm like, no, everything in life is public health. And that's what I tell myself. So I'm getting ready to go back to that, definitely. Even beginning next week, I'm like, you know what, I'm going to share my story, because I can only be who I am. But I did create it because I wanted to be a source of inspiration to those about failing out of a program. And then my nonprofit, like you asked, when I backtracking, guys, when I first moved to the US, I wanted to open a nursing home in Antigua, instead of the art nursing home. And I have to be a millionaire. I'm saying I'm not gonna get. I'm gonna be a millionaire one day, but I'm not there yet. So what's the other way I can do? And you know, I'll give a big thank you to my parents, because again, guys, I'm not gonna. You know, I grew up pretty privileged. You know, my father. You know, I just grew up privileged in a sense, where my father is who he is. You know, he's traveled the world. He's considered a legend of his sport. So my life was not, I guess, like the average person's life. You know, I had everything I needed. And ever since I was a little girl, my mom would always give back to people who were in need. And, you know, you're young, like, oh, why are we giving me all shoes? Why are we giving me all clothes? And it's like, she's like, if you have more, you can always give. And she's always taught me and my sisters that. So I've always been in like a giving, or been given, you know, to people ever since I was young. But it wasn't until I went to Uganda, when I say that trip changed my life, that's what I'm talking about. I went to Uganda and saw how people, because as the class, we all took items to donate to those children in the slums of Uganda, and seeing how grateful that they were. And it was, you know, we were giving them, some were useful, some were new, but, you know, we were giving them stuff that was born already, and they were so appreciative, so grateful to get that. So I said, okay, you know, that's something that I can do. I said, even if it's just, I'm impacting one family, again, because my thing is, even if it's just one person. When I started my blog, if one person read the blog, that was a win for me. So it was, I'm always with this one person or one thing. And I said, okay, my blog is called All About the Scrublife. You know, I mainly work in healthcare. I'm saving lives, we're helping people. So that's really how Scrublife case came about. It was like, okay, I wear scrubs to work at the time. I'm saving a life and I do care about people. So that's how Scrublife case came about. And when I started it was like a one-man show. It was just me, my parents, and my siblings and a few close friends. And I was like, how are we going to get donations? Because I know I have a lot of stuff here, but outside of that, should I ask people on Instagram? And I remember posting that flyer and the feedback that I got. I was like, wow, you know, people really are willing to give back, you know, to those that are in underserved communities. And I said, okay, it's time for me to go and make this official. And people reached out to me from back home. I didn't really vet or screen any of them because they're like, oh, I want to be a part of it. And again, you know, just wanted to give back. And that's how we came about, and we've been doing it for 2 years now. We officially launched as Scrublife Case last November. So we're currently going to our 501c3 status here in the US and then getting our registration back in Antigua because it's, how should I put it? Is it bi-coastal, you call it, Omari? You know, because it's going to be here in Atlanta, Georgia, where I am, and also in Antigua. But we've been establishing our relationships in Antigua first, and then we're going to be working towards establishing partnerships here in the US or here in my community to give back. Because again, I see a lot of room for improvement or help here where I live. So I'm trying to break into that. I've made some connections, but I think the hardest thing that anyone would ever tell you, when you start in a nonprofit, it's a lot. It's stressful. I am losing sleep to this day. I lost sleep last night because I was up working. You know, you want something to be successful, and I don't want it to be, I want to take my nonprofit global, but of course, when I told you guys I don't have patience, I want something to happen. If I have an idea today, I need for it to be executed tomorrow, but I've been learning to be patient and understand that, you know, with these things, it takes that, especially if you want it to be reached to a level that you envision, you have to be patient and just take time. And it's okay to ask for help. Because even though I have a team, I was able to build a team, I'm still like, I haven't learned to let go of it. I'm working on it though.
That's like the baby syndrome, you know, because you feel like it is your baby, so
Yeah.
you don't want to give it up to anyone. So
Yeah.
tell me about the progression of your team. So you said that you had your mom, your dad, your sisters, and some friends helping you, and then how and you said some people from Antigua like reached out and you didn't really vet them, and now you see that you have a team. So tell me about all that progression.
Yeah. So they saw the flyers and they said they were interested, and I said, okay, you know, I told them because backtracking, I took a nonprofit class, like one of the elective in school for my public health degree. And that was one of the options. I said, you know what, I want to start a nonprofit. Let me get the education to see, you know, I mean, you can only learn so much in a semester, but we did really good. And in that nonprofit class, we had to build a nonprofit organization in the class as part of our project. So I technically built the nonprofit while in class. Funny, this is such a funny story. You know, obviously I had to tailor it now, but I built the nonprofit from being in that class. So you have your strategic plan, you know, your budget, these so many different things. So whatever I built. So when those people reached out to me, we had an official meeting because I think I traveled back home last year, March, before the world went haywire, before everything went crazy, to give back some items to the hospital and to this girl's home that we've been giving to. And I sat them down and I told them, you know what, this is what I'm trying to do, where I'm going to go, you know, show them everything. Are you still interested? Because it's going to take a lot of work. You know, obviously I'm in the US and you guys are in Antigua, but it's going to take a lot of work, sacrifice, and dedication. It's not, no, oh, I want to come today and just to be there for the photo op, because there's a lot of people, guys, you have to be careful. And I've asked for that discernment gift where I can see who's, you know, really there for the cause or just want to be there for the photo op. And, you know, they all agreed and made a commitment. And we've been, so that's really essentially how the team grew from that first set of people. We've since then added about 2 to 3 members who reached out. One was a medical student, and, you know, I had a little interview with her because I told myself, again, I'm a leader now. I can't have this mentality of, oh, you know, they want to help, let's bring them in. I got to make sure that who's coming into the organization, again, share the same values. So that's very, very important. And we, you know, had a little interview, and she was a good fit, got her on, and she's been 10 toes down ever since she came on board. But the group, my team is mainly based on my friends, like friends who are not, because guys, let me tell you this, not every friends, if you don't mind me saying this, Omari, you know, you can have friends, but they can support, but they can support from afar. Mm-hmm. They're not meant to be directly involved in what you're doing. But the friends that I have in the group from ever since we were in high school, or some of us from primary school, elementary school, we've always been giving back. That's been a thing. And they've been 10 foot down or 10 toes down, sorry. And yeah, I'm just so proud of us. They said they're proud of me, but I'm proud of us for doing the good work, because it's for the people. It's not like, for us to do it for self. It's of the people, or for the people. And yeah, but running a team from afar, guys, it is not easy, but I am thankful for the team that I have. It can be frustrating sometimes, and again, I'm learning. I'm trying to put all these leadership skills that I would have learned in school to actually put it to use now, because I can no longer be, you can do what you want to do. No, this is a serious thing, and you have to. I'm trying to touch lives, So yeah, that's how the team came about. And I've gotten many requests. I want to be a part of your team. I say, you can be a volunteer now, because we have the board and everything. If you want to be a volunteer, or we call them ambassadors, and that's fine, because we're getting ready to launch a program this fall, and we will need all the help we can get. But again, everybody cannot necessarily be a board member or a director. You can just be volunteer. So yeah, it's been a lot. It's been challenging, but it's also been rewarding, and I am pleased. Outside of the stress and the sleepless nights, I am pleased as to where we are now, where we're going to be going.
Yeah, you should be pleased. You're doing some great work. So if somebody wanted to be one of these brand ambassadors, how would they reach out to you about that?
Well, right now, you can reach it on our social media, our website. We're currently working on that. It should be hopefully up the end of June. Because again, guys, a lot goes into building a nonprofit, especially when you have no money. You got to think about funding. But our website should be done at the end of this month. But you can reach it on Scrublife Cares on Instagram and Facebook. That's SCRUBLIFECARES, Scrublife Cares. You can find us on Facebook, Twitter, and Instagram, but we're more active on Facebook and Instagram. And definitely just send us a DM. We are quick with the response. Sometimes it's me, or it could be my social media team, which consists of my sister and another member. But they're really pretty active in trying to grow the brand and being, responsive. So definitely check us out there, see some of the work that we're doing, and any suggestions, we welcome them all, because we are still a young but growing nonprofit organization.
Yeah, and what do do you envision like the ambassadors doing?
Well, for right now, I'll say this, and I guess this will be the first time I'm officially saying it out. But we launched a literacy program recently, and as part of that program, we're doing like pilot programs to make sure. Of course, you got to do, as a public health person, you got to do your research before to see what happened before and then after. But right now, we're running a backpack initiative, giving those children backpacks with items in there. But the long-term goal for the literacy program is to offer a mentorship, tutoring, counseling, and to shape them, give them like life skills, character building or character development, these different things for life after high school. Because many people anywhere in the world, specifically in Antigua in the Caribbean, after high school, again, you finish at 16, 17, depending on, what's going on, they can't really afford to go to college. Because, we have a state college back in Antigua, you do a year or two, and after that, it's hard to find a job. And some people can't even afford to go to that college when it's like so much cheaper than anywhere else. Not everyone have the resources to even travel overseas, whether you have a green card or a student visa, to go to college, because parents can't even afford the tuition, let's be real. So we're trying to shape them, to teach them, you can go and get a trade or a skill, and you can still be able to live a fulfilling or get a job that's going to be fulfilling to you in that moment. So we're trying to, that's one of the goals for the literacy program. And we're getting ready to launch our period poverty program this fall, because we realized, living in the US, we've seen certain things as far as period poverty, but I didn't realize it was actually a thing back in the Caribbean. Because again, growing up, if you lack something, you go to your neighbor and that's it. But still, if you're lacking something, it's still a lack, So we're trying to end the stigma around period poverty, educate more about that, because believe it or not, from the research that we've been doing, I get a period every month, that's it. You have heavy cramps, or you're not thinking it could be something underlying as to why that's causing the heavy cramps. So our goal is to promote that health education, but also supply, like sanitary items for them to have every month. So that's our big project right now that I'm excited about. It is stressful, because again, building a program, thankful for my program and evaluation class at Georgia State, and I'm still in contact with that teacher. So she's the one that's helping me, or helping us, to build that program, because she sat down with me and told me, this is what you need to do. So again, guys, I'm going to piggyback this really quick. Networking with your professors is really important, because she's volunteering her time, even though she's busy, to help me to build this program for my nonprofit. Because even though I may learn something in school, I'm still new as far as like a nonprofit doesn't, it is a serious thing. So we're doing that. So yeah, we get ready to launch that in September, and hopefully, it'll be successful. It's going to be like our pilot program to see how well it does. But definitely trying to end the stigma around period poverty.
Okay, that's awesome, and I look forward to those programs launching and seeing how the great things that are gonna unfold for Scrublife Cares.
Yes.
Tell me more about the pivot, because you were initially just doing this in Antigua, and then now you're trying to do it in Georgia as well, or Atlanta, I should say.
Yeah.
So tell me more about that.
Well, obviously, I live in the US. I mean, I don't want even though it's going to be, my goal was always to serve Antigua. I think that I have a very good team back home. And again, I have ties to the community. So it's somewhat an easier transition. Not as easy, let me put that clear, but it's an easier transition because again, I grew up in Antigua. It's a small island. Everyone technically knows everyone, and it's easy for me to get certain information, and I have that solid team back home that they're actually putting in the work as well. So I can now breathe a little, even though I'm still not letting go. But I'm like, I'm living here, and every day I'm driving, I'm seeing someone sleeping on the, outside. There's a lot of homelessness here in this state, and it really, really, really bothers me. And a few of my past co-workers, they've donated to our organization, and they've brought it to my attention. We have this girl or this family that needs something. I'm saying, okay, I'm giving everything to Antigua, which is a good thing as well, but I'm living in a community that needs help as well. And even if my philosophy, even if it's one or two people or two families that I can help, it's still something. So I say it's time for me to change my mindset and help those around me, directly around me, because now I've mastered life in Antigua, to put it that way. I used to be that person, okay, I'm just living here and paying my taxes, let me just go. Everything is back home, which is not a bad thing, but whatever impacts my community, it can eventually or potentially impact me where I'm living. So that's kind of where the idea of, trying to take it here. And again, with the mindset of taking it global, how can I take it global if I'm not taking care of what's happening around me? So that's really what it is. So just trying to network and reach out to people in the community, which I've been able to do so far. Trying to build now. It's still fairly new relationship, but still building to see where that can take us, and learning patience and understanding that even though I'm making these relationships or connections now, something may not happen right away. And that's the biggest thing, especially being a leader, you want to help so bad, but you have to make sure it's being done right to avoid burnout and to also avoid failure of something not working. Granted, things can happen, but you want to make sure that you're pacing yourself to make sure that you're doing the good work and doing everything right for my community. So that's where the idea came to expand here to the US.
Yeah, and that makes a lot of sense. Because you are living locally, and it is a local community that you're also trying to see that there are issues or like just opportunities for you to help people.
Yeah.
So that's definitely important. Is there anything else you wanted to share about Scrublife cares?
No, just be on the lookout for us. Make sure you follow us on social media if you want to donate. We do have a PayPal you can donate to if you want to, $10, 5, 10, 2, 1. It will honestly go a long way in the lives of these youths that we do cater to, and in any population really. But our main focus is the children, because I believe truly, I'm now seeing that our children really are the future generation after coming through and getting older. But if you want, you can donate to us by PayPal. Our website should be up at the end of the month, but definitely follow us on our social media to be in the loop for the great things that we have done and will continue to do. Any support will go a long way. Even if it's a share a flyer, we accept that as well.
Okay, awesome. I will definitely. Well, when you do get the information for that, just give it to me and I'll put it in the show notes.
I will.
You can
right.
it as well. So you are currently a birth and postpartum doula and placenta encapsulation specialist. So what's your training like to become a doula, first of all?
It's intense but rewarding. Again, like I've been echoing throughout the episode, maternal health has been something that it's been with me since my sister gave birth. And I'm like, okay, what can I do? Okay, I have a public health degree. What can I do now to get my foot in that door as far as maternal health goes? And someone recommended, oh, you should become a doula. At the time, I didn't know what a doula was, but I didn't do my, I said, really? I said, me can become a doula, again, sometimes not thinking or believing in yourself. And I said, okay, I did my research and signed up for the class. And it wasn't intense. It was a 3-week class. Usually it's a 3-day class. Because of COVID, I did it during COVID. You have to spread it out. And you learn, guys, you learn childbirth education, lactation when it comes to that, the birth process and everything. Those are what you technically are learning. You're not a clinician, so you're not going to be delivering babies or catching babies, as they would say, but you are there to offer emotional and physical support to that family or that birthing person, and also, as we like to call it, an informational support, because we should know. We like a human dictionary at this point when it comes to the birth process. So, but it was intense. Learn many different techniques. I was like, wow, this is what I'm going to have to go through at some point in time. It's just, let me tell you, I've learned a lot that I didn't even realize. It's just so funny that you think you know it all about something, and then when you actually learn about it, you realize, wow, I didn't really know anything, or I didn't know as much. So it was a pretty intense training, but really rewarding training. You know, of course, you get your certification at the end. You have to attend, you know, at least 2 to 3 births to get the certification. And then, so the birth doula part to me, I think was easy is the postpartum, because you got to make sure you're dealing with postpartum depression. And what I've come to learn, we always say, oh, I got postpartum depression because I'm crying or I'm moody, but there's more to it than just postpartum depression. And I honestly don't have all the education that I'm currently in the class to really get more knowledge. And, you know, it's perinatal mood anxiety disorder. That's a whole different ballgame, a whole different topic we can talk about. So, you know, there's just so many different things that I'm learning. And again, trying to educate and empower my community, because as an African American, as a Black person, again, the rates in this country, it's just ridiculous. So trying to be that advocate for others, be that voice for the voiceless. Because again, my sister, case in point, she could have listened to that doctor and not gone through, and we wouldn't have had my niece or miracle baby. You know, if I wasn't at the time a hot mouth, as I call myself, like, I said, you're not going to tell her, you know, but I was being an advocate, but it was more of anger. But when I'm thinking back, I was like, well, you know, if it wasn't for me, maybe who knows what would have happened in that moment. So that's one of the reasons why I decided to become a doula, because I wanted to be an advocate for my people as far when it comes to the birth experience. So that's what the training is. Pretty good. It's a 3-day. It is cost effective in a sense, depending on, you know, where you live as well. So if you're thinking of becoming a doula, definitely do your research, because it is a rewarding feeling, knowing again to be of service to others in the most sacred and precious time of their lives.
Absolutely. And yeah, we can definitely loop back around and talk more about that in the future. So talk to me about the placenta encapsulation specialist part of this. That was fascinating.
Yes. So I did a training a few months ago where I've always heard, oh, you know, your placenta have this amount of nutrients, but you're just like, what? No, you know, again, when you don't know, you just become ignorant to certain things. And I just had to take the class to trying to enhance. Again, guys, I'm all about enhancing and adding some kind of skills to what I'm already doing. And, you know, I've learned that there are many benefits to consuming your placenta in the form of, like, you know, a tablet, or you can do like a body butter now, like a lotion. Like, there's just so many things you can do. And it's initially a traditional Chinese medicine practice where you know, it helps with like the milk flow, energy, help with you're not losing your hair, because that's a thing. That's a real thing for a pregnant person, to lose your hair after giving birth. So there's so many different benefits to consuming your placenta. So I'm like, you know, okay, let me enhance that skill. And it's just a whole long process where you gotta cook and dry and grind and everything as far as the placenta goes. But my goal is to let people know that the benefits behind it, because we've seen parents that say, oh, my milk is not producing, I'm not producing as much milk. That can help, you know, help with healing. If you were to have a C-section, that it helps with healing faster and these different things. So I did the class, and I did all the different requirements, and I'm a placenta encapsulation specialist. You know, so if you're looking for your placenta, you know, birth doula, you know, you just hire me, you know, walking around like a human dictionary or human encyclopedia. But yeah, it is a rewarding feeling knowing that I'm in the arena as far as maternal health, and I can do more going forward, set myself up so when that time comes, you know, I have the experience, just tell me what to do next, that type of thing. But it is rewarding.
Yeah, that is awesome. And I've definitely seen some like placenta stews and things like that. People actually like cook them, which is very fascinating. But I definitely think got to keep an open mind to these kinds of things, because especially in Black communities, I feel like we have been taught that there's only this one way to have a baby and things like that, and it's very institutionalized.
Yes.
It's taking us away from, and that institution by itself comes with a lot of trauma.
Oh yeah,
so,
another topic. Yeah.
So I definitely I'm glad that you spoke about this, because this is definitely not something you talk about every day or hear about.
Yeah, we don't. But, you know, just trying to start that conversation and not making so much these topics be as taboo, because, you know, it's a great thing. And again, when we educate, when we know more, we do better, you know.
So I forgot to add questions about Tea with Tanya podcast. If you want to, we can talk about it now, and then I'll just add it in.
Okay. And yes, guys, I do have a podcast. It's called Tea with Tanya podcast, where I talk about public health stories, life. You know, it's called tea because I'm a tea lover. When you're from the Caribbean, if you have a pain in your finger, you're going to drink tea no matter what. It's always going to tell you to drink tea. So that's kind of like the idea where that name came from, because, you know, I talk about many different things: women's health, maternal health, life. So definitely check it out on Spotify, Apple, wherever you get your podcast. And of course, like, subscribe, and let me know what you think. My DMs are always open for any feedback. So you can find me at Tea With Tanya podcast.
Yeah, and why did you want to start this podcast?
Because I at first I was going to do YouTube, but I feel like my voice, I'm in therapy, guys, because I'm trying to get my mental health together. And she told me, yeah, your voice is going to be heard anywhere you want it to be heard. And I said, you know what, let me go ahead. I had the Instagram live series I was doing at first, trying to bring some awareness to public health at the time. And I was like, okay, you know what, I'm getting good feedback. It's easy for me to talk, even though I have an accent and I speak fast. It's easy for me to talk and express how I'm feeling without feeling judged or, having to do too much. It wasn't as much work as even having a blog. Sometimes you got to sit and think about what you're going to write, edit, and get pictures and all these. A podcast, I can just speak freely about whatever's on my mind, and of course, educate and empower while having fun. But it's just easy for me to speak because I like to talk. I am a talker since I've been a little girl. So that was it. And just to, again, educate and empower, in a different way, because many of us know, like for me, like listening to your podcast or any podcast, I'm driving in the car, my commute is long, I'm in the shower, whatever I'm doing, I can read it, I can listen at my own convenience versus having to read. You got to actually stop what you're doing to sit and pay attention to. With a podcast, you can just listen on the go, listen while folding laundry. So it was just the easier way for me to get my thoughts out. And the feedback has been great so far, and I'm happy I took that leap, guys, because again, you can let doubt creep in, but I took that leap, and here we are, one season later.
Yeah, that's good. That's great to hear. And I definitely subscribe and check out the podcast, everyone. And I think podcast is the way to go now. It's the future for the most part.
It is. It is.
Yeah, absolutely. And then lastly, well, not lastly, but you recently shared some information with me about going and wanting to do your MPH. So talk to me about the process and thought process of this. And I know there's some insights because I don't think many people have heard this as yet.
I graduated in 2020 with my bachelor's, and I decided to take a break because I'm like, I've been going to school since I was 2 years old. I've heard so many no's, so many rejections. What do I do next? And rightfully or naturally, I was going to do my master's in public health. But as you guys have heard me say about this nursing throughout this episode, like, nursing is really a passion of mine. And now that I have the public health background or experience, in a sense, I can now merge the two of them. So I'm deciding to go back to nursing school, my master's in science in nursing. Hopefully, once I go to school yet, because I got to wait. Like I was telling Omari, I'm trying to wait and see. But definitely, I'm going to be pursuing my master's in public health and master's in nursing in 2022, because again, I'm out here just waiting, don't want to rush into anything. And during that time, I'll be getting into more certifications again. That's what I do. I just can't stop learning. But definitely going to be pursuing my master's in nursing and public health. So that's going to be, if you see me on Instagram asking you guys for help, please, because I'm sure in master's in public health by itself is already challenging. So imagine me putting that with a master's of nursing. I don't know how I'm going to do it, but I will. But I'll definitely have an update for you guys as to which program I decide to go into. But just send up some positive vibes my way as I wait for these.
Yeah, awesome. We definitely will send a lot of positive vibes. Best of luck, and we look forward to seeing that part of your journey unfold.
Thank you.
So where would you like to see yourself in the future?
Interesting question. I would like to be working full-time for my nonprofit, get it to the level where I can be paid as an executive director. And funny thing, I want to say this really quick, Omari, because of you again, LinkedIn and networking, I was able to meet someone, the person who's helping me now, or helping us as far as getting our 501c3 status here in the United States, with 25 years of experience just from LinkedIn. Like I was utilized and say, you know what, you gotta reach out. I joined many different groups and put things out there. And she has 25 years of helping people, with grants and funding and these different things. So I'm working along with her to that. But in the next 5 years or so, I want to see us, I guess, on every continent we possibly can be, global, but me working full-time for my nonprofit. We'll see. It's still a process. We'll see. But the long-term goal is for me to be working full-time there. And of course, traveling and helping people in different parts, using my public health and my nursing experience to make the world a little bit more better.
Yeah, absolutely. And we could do it a little bit more better. So we appreciate you pushing on and doing these things. And I hope that your nonprofit is able to get to that level of sustainability and range as well.
One day at a time,
Yeah, absolutely. So moving on to the last section of the show, the Furious Five questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
Definitely do your research. Don't be like me, have, someone telling you and you're just not even researching what public health is. Make sure, and I'll tell you what somebody told me, don't do it for the money. Definitely do your research, but do it that you want to fulfill yourself and you want to do some good and be of service to others in this world, because definitely that's what public health is, to be of service and to, improve and make an impact in a small way, or it could be a big way as well. So definitely do your research, and of course, make sure you're doing it because it's coming from your heart. And that's just as simple as I can say, because if it's not coming from your heart, you're not going to enjoy public health, and that's the truth.
True. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
You know what? 3 words: perseverance is key, because I've heard so many no's in my life as far as my educational journey and, trying to build my career. And if I listened to those no's and just not, I could have gone back home to Antigua, probably not even have the same ambition that I had or have now. So definitely always keep persevering, keep pushing. One no does not equate to the end of your life or end of your career or your goal. Just keep persevering, keep pushing, and eventually understand that you can take an alternate route to your end goal. So that's what I'm doing. I'm in this position now because I've chosen to take an alternate route to my end goal.
Awesome. Number 3, what's something you're working on improving in your life right now?
Being patient. I have to say that because, I like to say I'm multi-passionate or multifaceted. So I'm multifaceted. So I'm trying to do a million things at the same time, and I want overnight results. Even I know it's not going to happen, but because I'm so excited and eager for it to happen or come to fruition, I like that patience. So definitely I am trying to be patient, understand that nothing, like I always preach to myself, nothing happens before it's time. You got to just take that time and it will happen. So definitely patience.
Absolutely. And I think that's some good advice to anyone out there. Number 4, professionally, do you recommend anything?
Yes, this podcast, the public health. Yeah, let me tell you, I've listened to some people here. I said, okay, let me drop this down. I kid you not. I wish I had the book in here. I'm like, let me do this and reach out to this person. So definitely this podcast. And if you are a birthing partner or someone who's planning on getting pregnant, this book is called The Birth Partner, I think by Paddy or Penny Simpkin. That's the book that we had to read for our doula class, but it also works for expecting parents. Definitely, if you are soon to be expecting or plan to, that book definitely is a game changer. So that's the lesson that comes to mind. But definitely this podcast too, because there's too many value here.
I appreciate that a lot. Last but not least, where can people connect with you?
Oh, yes, you can find me on my website, allaboutthescrublife.com, which that's going to be changed to TanyaAmbrose.com. But, I'll make that announcement when it actually happens, hopefully the end of this month. And then you can find me on Instagram at Labor with Tanya K and Labor with Tanya Doula Services on Facebook. And on Twitter, Tanya K Ambrose, but I'm not the same person on Twitter as I am on Instagram.
I know how that goes, and that's Label without a U, everyone.
Yes.
You're wondering. Well, thank you so much, Tanya, for coming on today and sharing your story. I really appreciate everything that you have done, and I look forward to your journey continuing to unfold some more.
And thanks for having me. It's been a dream, guys, to be on this podcast. Me being here, that's a goal that's off of my list now. Thanks for having me, Omari. Appreciate it.
Yeah, it truly is my pleasure. I'm glad that you're able to take that off your list and that you're able to share your story. I know there's a lot of value in it. So for everyone else, thank you so much for watching or listening to this episode. Be sure to subscribe, leave a like, review it, and share it with a friend. And if you want to support the show, go to buymeacoffee.com/the PH Millennial, and you can support there. But thank you all so much, and I will see you all next week.